kind of leads me into, as a therapist and being involved again in the therapeutic community and being involved in teaching this with you for the last 20 years or so. I don't know how long we've done this now, where I joined in with you in partnership to expand some of the concepts, but neither here nor there. There's been a real kind of taboo or undercurrent in the SI community or sensory processing community about spinning, and that it shouldn't be passively employed. And what about individuals that are under responsive? And I don't know if you could speak to that just very briefly.
Well, vestibular input is very, it can be very intense. And so part of learning how to precisely activate the system is to know how much is the right amount for each individual, because even though there would be in a perfect world, there would be a one way of rotating everyone, but because we each are unique, we have to really be able to observe each individual and give them the just right challenge, which means that they would quickly recover from it. Children do movement for fun. When they're doing it for fun, they obviously get dizzy because that's just a natural response. But they should have quick recovery from the dizziness. And so one of the concerns is to not overload the system.
And I just want to add another note from normal development, how just as a relatively new grandmother, that both of my granddaughters, although very different sensory integrative systems, one potentially a little more integrated than the other, different needs, both of them spin themselves naturally. And I noticed that they did that around the age of 2.5, where they found that they could rotate and they could feel dizzy. And so it reminds me of what you said about that kind of adaptive response, if you will, that they're playing with how much of this can I handle, and woo, look what it does to my body. And wow, how long does that last? That curiosity about movement. So anyway,
naturally discover that with movement they are much more aware of their environment. It makes them more aware of their own movements, so that that's the age when they are able to be free in space. They're starting to manage their own bodies, and so they're just very curious about how to move in many different ways. So a typical child in a really rich environment is really going to activate all 5 of the vestibular receptors. But if they've had some challenges, that may not be the case.